Geetha Govindarajan is next. She's MD, PhD, MPH. She's currently the Associate Medical Director of a community clinic in Chicago. Thank you.
Good morning, and Sairam, and I deeply offer my humble salutations to the divine in each and every one of you. Thank you for the opportunity to be here today and to share a little snippet of my medical journey with the rest of you. I begin my slide with introducing you to the main protagonist of my talk, the lady who coined the term "I have no complaints" and now happens to be the main reason or the title for my talk. This is Laverne Everhart. She is our lead medical receptionist at the Friend Family Health Center where I work. She has been working there for the past 11 and a half years. She is the epitome of positivity in our clinic, and no matter which day of the week it is, no matter what day of the hour it is, no matter when you ask her, "Hey Laverne, how are you doing?" her response is always an emphatic, confident, "I have no complaints." And she always says it exactly the same way. And it doesn't matter whether you're a provider, you're an MA, you're a nurse, or you're a patient. It's always the same. It's interesting, right? Because my day begins with complaints. I'm a primary care health provider. I have a patient panel of about 5,000 patients. I practice in the south side of Chicago, which I'll come to in a second. But complaints is just such an integral part of being an internal medicine provider, chief complaints. But what is fascinating is this upstream thought that this lady has managed to echo through my head now for the past 4.5 years that I worked here at this clinic, and trying to see what she means by that. Oftentimes complaints, in the last 4.5 years I've progressed from just being a clinician to more of an administrative role in this organization, and I get complaints from my providers saying how their schedules are overpacked, how they don't have enough staff needs, they don't have resources, et cetera, et cetera. The laundry list goes on. And in all of that, and my own schedule is packed with 20 patients for the first 4 hours. Sometimes we have 3 overbooks, 4 overbooks, depending on which day of the week it is. And how do you try to practice ideal healthcare in a setting like that, in trying to incorporate what Swami has taught me in my personal journey? And I think that's been the interesting, conundrum that I've had. And ever since Dr. Reddy and Hari Uncle have been asking me for the title of my talk, and after I've given it to them, I think it's been increasingly more harder to try to understand what this means, because it seems like the complaints have exponentially increased, and that's how Swami tests you. And what is fascinating in understanding all of this is also to pay attention to how we as providers can be resourceful to these patients who are coming to these health centers, not truly giving you their concerns and expecting you to transform their complaints into something tangible that they can walk away with. How can we create a space that would allow them to transform their complaints to an advocacy state, which is what I feel like Laverne does for our clinic. Laverne is a recovering cocaine addict. She is a breast cancer survivor, and additionally, she also had a stroke, which left her with right-sided residual deficits. I just want to take a moment to explain to the audience what a community health center is in the United States. It's in the primary care setting, 1 in 12 Americans use the community health center for their healthcare needs, and there are about 1,400 health centers all across the country, serving about 26 million people. And the mission that was under which these community health centers were created about nearly 50 years ago, was to provide high-quality, cost-effective care services just about to everyone, regardless of their insurance status or their ability to pay. And the goal of them is to offer service to just about everyone, which is in alignment with what Bhagwan Sathya Sai Baba says. And the beauty of it is it's community-owned. So it's a medical home for the communities that live in that particular area, and half of the board of directors are part of they actually are community health center users themselves. So to me, working in this community health center has been a life-altering experience, because I have learned leaps and bounds from each and every patient that has walked in to my office. The speakers that have spoken over the course of this conference have always talked about creating a space in which the patient is able to open up. And to create that space requires you to be an active listener. Half of the healing happens in that space. I am reminded of a speaker that spoke to us during residency, and he was a speaker who used to attend to the Dalai Lama. And what he said has left an indelible impression in my heart, which manages to tell me that this is how I should operate, even though it seems like my schedule is filled with tens and thousands of patients, and I feel like I'm not able to do justice to these patients, which is simply that you never treat the person that comes into your office as an ordinary person that walked in. It's an extraordinary moment that has been divinely designed for many a decade, many a centuries, many a lifetimes. Imagine when you start thinking about all the steps that you had to take to get to this point where you were able to serve this particular patient, and think of all the steps that this person took to come to your room, to open up their heart, their soul to you. This is not an ordinary moment. It's an extraordinary moment. The moment you start thinking about it and see the patient in that light, you realize that this is not you working, that there is a divine principle that's working through you, and that's when the healing happens. And when I think about that, it blows my mind. And it's such a privilege and honor to work for these patients and their rights. The south side of Chicago where I work is the hood. It's on the south side where, commonly, the statistics are high for gang violence, for drugs, for failing schools, foreclosed properties. And it's such a juxtaposition against the beautiful skyline of Chicago that everyone sees. And this has been my learning ground ever since undergrad onwards to now. I, through the Sathya Sai organization and the young adults, and several of them are here today, our journey began there because we spent a lot of time, almost every weekend of our either grad school or a working period, at this in these neighborhoods where we did work with the youth, and these programs included educational programs, mentoring programs, and now more recently in the free clinics that have been set up through the Port Ministries, which is a Franciscan ministry that works specifically to offer free healthcare to those that do not have insurance. And it's a sizable population there because we have a huge migrant community, and a lot of undocumented workers live there. And so this is a free community. A lot of our youth go and volunteer. And what we found that through working in my organization and also through this, there are several areas where we're not able to truly reach out to the patients just because these patients are not willing to come to the clinics. And that's when we realized, like working with the Sathya Sai Mobile Hospital in Puttaparthi, that it is sometimes necessary for us to go to the community. And that was the main thought behind this particular project that me and one of my other young adult colleague here, we embarked upon this project through the Schweitzer Fellowship, which is the HOW, which is Health on Wheels. So our idea was to basically do a mobile outreach intervention to take preventative health dialogues to their doorsteps. So by partnering with the bread truck that was already delivering food, we added a health component to it, which was educational, screening, and access issues, and tried to reach out to this community. And the results were phenomenal because these patients opened up And they came back, and we were able to loop them back into the different healthcare centers in the neighborhood. And so these are some snippets of our conversations with these individuals in the community, and it's an ongoing process, and we're going to continue to work and build on them. And I just wanted to throw this in there because when you work in a community health center, it's an interesting experience because what walks in through the door, you have no idea. This is a gentleman who's 80 years old who works and has grown up in the south side of Chicago. He asked me 1 year prior to him coming in with this bag of okra and tomatoes what my favorite vegetables were. And mind you, in the hood, there aren't any community gardens. There are only concrete jungles, at least in the area where he was living. He's like, Dr. G, because that's what they call me, and Dr. G, what do you like? And I said, well, my favorite vegetable is okra. He's like, okra? What's that? And so he had never heard of okra. And I tried to explain it to him, but the encounter was brief, so he went away. So this gentleman, at 80 years of old, and he had lumbar stenosis and whatnot, and he ended up researching what okra was. He brought seeds. He had to go outside of Southside to get these seeds, grow them. 1 year later, this is what meets me on my desk, saying, Dr. G, here's your okra, because he still can't say okra. He's like, here's your okra. Make sure you make something good out of it, okay? So what other way can you even begin to sort of see how these community members see you as their own family members? They pray for me when I take an exam. They pray for my parents if they're going through some tough time. They become part and parcel of this extended community that we are. And the only way that happens is that when you accept them as part of your family member, when you begin to think of themselves as your own kith and kin, and then that's when you practice medicine in its entirety, the way Sathya Sai Baba has laid out. And to me, there's been three things that I just wanted to briefly conclude with, which is the individual journey, creating value in the journey, and maintaining balance in the journey. I think as a youth force, we have the incredible ability to mold what the society, to work with society and create, lasting impressions. And we can take the advice that we have from our elders and transform them in a way that will make sense for the communities that we work in. It is important for us to think locally, think globally, but act locally. And so I think this is a clarion call for all the youth that are here to take inspirations from all that you've heard in the last couple of days and see ways in which you can go back and impact your communities. And so in closing, I want you to just listen to the words of Laverne, because I could not conclude the speech without letting you hear her words.
Hi, everyone. My name is Laverne Everhart, and I work at Friend Family Health Center as a senior lead medical receptionist. I've been employed at the Friend Family Health Center for about 11 years. For me, I take each and every second of my life as a precious moment. Life is beautiful, and life is a blessing. So no matter where you are, what you do not forget this mantra, the mantra that always enlightens your moment and keeps your smile with you. I'm sure you will need this down the road, and the mantra is, I have no complaints. Take care, everyone, and enjoy the conference. Have a blessed day.